everyone, my name is Aisha Sheikh, and this is my presentation for the case study for HAP 725, where I examined the performance of Thomas Jefferson University Hospital. So, to begin, let's talk about the data that was utilized. The data was obtained through the Centers for Medicare and Medicaid Services website. The link is listed here on the slide. This data is publicly reported, and most of the data was submitted by hospitals through various reporting systems. The payment and value of care for hospitals were obtained through Medicare claims data. And the hospital characteristics were through data submitted by hospitals through the CMS Certification and Survey Provider Enhanced Reporting System. For the purpose of the case study, we examined measures that had more than 7 quarters and used 3 different competitors for the study. I'm going to give a brief overview of Thomas Jefferson University Hospital. Jefferson Hospital was founded in 1825 and grew into a large network of hospitals and physician counties that now service in Philadelphia, Montgomery, and other locations in Pennsylvania. Thomas Jefferson Hospital also has a university program associated with it, which is why the full name of the organization is Thomas Jefferson University Hospital. For the purpose of this case study, the location that was utilized was in Philadelphia, Pennsylvania. It is important to examine and understand the limitations that were involved with the case study. The first limitation is that the data that was examined was not available for all the years. It was important to examine the measures and choose measures that had an appropriate amount of data available to create an accurate image of the results. The years that were utilized for this case study was 2015 to 2020, using different quarters among those years to capture at least 7 quarters. Another limitation for the case study is that some measures had a change in name. For example, the measure for COVID-19 was implemented in recent years, as opposed to previous year where influenza was measured with a different name as compared to the most recent year. It's also important to note that only 5 measures were used in this case study. This does not allow us to gain a full holistic picture of the hospital as a whole, and rather focuses on a specific area that would create a smaller image of how the hospital is doing in certain regards compared to their competitors. For this case study, the specific condition for a patient that was examined was a patient that had heart failure. Some measures that would be beneficial for a patient with heart failure to examine in a hospital would be the heart failure 30-day readmission rate, the death rate for heart failure patients, which is the 30-day mortality rate, the immunization for influenza among staff. I chose this because it's important to know the vaccination rates of staff as someone who is susceptible to the disease and more vulnerable. We also examined the payment for heart failure patients and the staff responsiveness. Patient care is vital to a patient's experience and can play a role in a patient's overall health outcome, which is why I decided to include staff responsiveness in my study. The hospitals that were used as comparison were Temple University Hospital, Pennsylvania Hospital, and Chestnut Hill Hospital. I chose these 3 hospitals as they are all located in the Philadelphia region and offer similar services as Thomas Jefferson University Hospital. These would all be hospitals that a patient who has heart failure could also potentially utilize. Let's examine the first chart, which looks at the readmission rate for heart failure. As you can see in the chart, Thomas Jefferson University Hospital had a higher readmission rate from 2015 towards the end of 2018. In this situation, a higher rate is not seen as good, as patients during this time were readmitted for heart failure at Thomas Jefferson University Hospital at a higher rate compared to their competitors. From early 2019 onward, you see that the readmission rates begin to fall in between the upper and lower limits. So the hospital is not performing worse or better compared to their competitors during this time. Moving on to the next chart, we are going to examine the heart failure mortality rate. In this chart, we see that Thomas Jefferson University Hospital was doing well compared to their competitors in 2016 through mid-year 2017. Then there was an uptick of rates where the hospital had a higher rate compared to their competitors up until mid-year of 2018. From there, we saw a slight decrease to where Thomas Jefferson University is now currently performing in between the rates of their competitors. Looking at our next chart, you can instantly see that Thomas Jefferson Hospital is sitting above the upper limit for this measure. This chart visualizes that Thomas Jefferson Hospital consistently is doing well amongst their competitors in terms of vaccinated staff for influenza. As we all recently experienced the pandemic, the importance of vaccinations for the sick and vulnerable population was shown to be incredibly important. Overall, this measure is a strong point for the hospital. Moving on to our next slide, we are going to examine the payments for heart failure patients for the hospital. I chose this as financial components are a very important piece to many people as they are examining where to receive their care. In this chart, you can see that Thomas Jefferson Hospital was performing slightly below their competitors, but saw an increase gradually to where they are now performing well above their competitors in recent years. This could be due to changes in payment methodologies and patient-payer mix. This last measure, shown in the chart, examines the hospital staff responsiveness. You can see that Thomas Jefferson Hospital saw an uptick in 2016 and now consistently is doing better in terms of staff responsiveness compared to their competitors. As someone who goes in for heart failure, it is vital that you receive the best and most attentive care, and you would factor in how a hospital ensures that they are being responsive to your needs. To summarize the findings from the case study, we can state that for a patient who is going in for heart failure, we can expect that Thomas Jefferson University Hospital is going to do better with their staff immunizations for influenza, payment reimbursement, and staff responsiveness for their care compared to their competitors. Where we can expect to see some shortcomings would be the readmission rate for heart failure and the mortality rate for heart failure compared to their other competitors in the Philadelphia region. For Thomas Jefferson University Hospital, there is room to examine ways to improve these measures through past practice examinations and further research to enhance the patient experience for patients with heart failure. And here are my references that were used in this case study. Thank you so much for watching.